Hi, everyone. My name is Labake Riley. I'm a nurse researcher, and my area of interest is improvement of care regarding older people, age 65 and older. I believe in using evidence-based practice to reduce the cost of care to this population and to increase their independence in self-care. My EBP project title is Frailty, Depression, and its effect on instrumental activities of daily living among people aged 70 years and above. In this particular book, I will be using independent variables, IVS, frailty and depression, and then dependent variable DV, instrumental activities of daily living, efficiency. And the reason for combining these two is because of the comorbid activities that is leading to all these problems. Background. Prevalence of frailty average in America is 11%. The clinical conditions that the study aims to change using clinical evidence include depression and frailty. Frailty and depression are found to be comorbid in statistical data. The presence of depression raises the incidence of frailty by 59%. After adjusting their data for dementia, physical limitations, and social demography. Excuse me. The prevalence rate of frailty among American community dwelling elderly is 11%. Nonetheless, the rate of frailty varies depending on how the clinical condition is described, with the percentage ranging from 4% to 59%. Definition of frailty and age that determine occurrence. Definition of frailty means a clinical condition that primarily affects people in their later years. Frailty prevalence in adults age 85 and up ranges between 26 and 44. Target population are older adults and their family, which actually are the ones that really feel the brunt of their problems. The motivation is that patients that are affected are the elderly and their family are the project's target audiences. The fact that elderly persons are the most afflicted by two comorbid clinical conditions is why this project prioritizes them as a target audience. Purpose and importance of research. Purpose or the goal of the EBP study is to see if using research findings may help elderly people live more meaningful lives by reducing frailty and despair, addressing difficulties that limit elderly people's capacity to participate in instrumental activities of daily living, and this will make their life more meaningful. Previous researchers have not really, this study is to reduce frailty and depression levels among elderly patients, and also to reduce their hospitalization when they are sick, instead of going to hospital every time. This type of study will show them on how to take care of themselves. And then introduction of patient education as an intervention. Educating older people about coping skills will also help them to know what to do, to know the type of exercise they can do that will allow them to be able to cope with take breakfast, their personal care, and cleaning. Knowledge gaps. Yeah, primary studies of frailty, depression, and it are very few. And as we can see, the previous researchers have not produced a primary study that uses human subjects or participants and incorporate frailty and depression as variable affecting senior people's capacity to participate in IADL, that is instrumental activities of daily living. So although they do not use a primary research approach and they do not include depression, because the current research gap, a primary study combining the two variables both frailty and depression is needed to generate data on the variable that affects on ADLS. So we are saying here that because this is not a popular type of research, many researchers didn't pay more attention on these elderly people. And those are the reasons why while I'm doing this project, to make it known to people that elderly people need help. Elderly people needed help in such a way that the things they can do to make their life more easier and better. Proposed methodology. The design is experimental and the sampling is purposive. The project is using 3 peer evaluation tools for geriatric assessment of potential participants are used to implement a further step in implementation. The instruments are the Geriatric Depression Scale, GDS, Denial of Frail Non-Disabled or Find Questionnaire in Nottingham. The GDS scale is applicable before choosing the best qualified study candidates to measure depression level of participants. F-Find questionnaire is designed to measure the effectiveness of participants' participation in IADL for purpose of assessing the participant fragility. The detailed discussion of each of the tool evaluated for the project is provided in Appendix 4. For actual study, the project shall apply inclusion criteria. The first criteria is the age. One must be over 70 years old to qualify as a member. Secondly, in the study, only candidates who receive more than 5 frailty scores are included. Third, IADL should be less than 67. Geriatric depression must be 5 and higher. In addition, the study will exclude a participant who is bedbound because of terminal illness. As sample participant for the primary study, only participant will be used in the study. For the fragility plus depression group, N150 will be used in the study. For the fragility plus depression group, 100 participants will be used, whereas 50 participants will be fragile but undepressed. The objective is to compare the impact on the efficacy of IADLS of fragility and depression alone. Qualified students will then proceed to a 12-month primary study, and S1 provides information on the project progress with informed consent. In the form of an education program, participants sampled and group will receive an intervention. The educational curriculum teaches the participants about the project. The project is using central tendency measurement, medium, and mode. The statistical analysis of chi-square method to analyze information in mean, median, and mode. Statistical changes of measurement of frailty, depression, and age will be analyzed and described at the end of each module. Chi-square methods for statistical analysis are, on the other hand, the right choice to analyze the dependence relationship between variables. The project will also aim to understand how the two variables, frailty, depression, and IADL efficacy affect the IADL effect in addition to monitoring and analyzing the change frailty, depression, and the instrumental activity of daily living effectiveness among the participants. In peer review and accessible global publication, the project will report its results. The aim is to make the result available to healthcare professionals publicly. The result will enhance the quality of the study for elders with fragility and depression, enabling nurses to access evidence from the project and to implement them in practice. The samples, age, depression, and the performance are all included. The geriatric scale, the mean, median, and mode is the one we use, as I've said earlier on in my presentation. Project significance to nursing. The field of nursing is critically dealing with various health conditions that affect older population, and they should pay more attention to this older population in order to help them with depression. This study will help them to know and understand and the frailty, which is a major issue that affects older people, instrumental activities of daily living. Nurses are urged to create new primary evidence that nurses will use to minimize the effect of frailty and depression in an older people. It will help nurses to understand, better how patient education works and how it will improve the health of the patients. Participant perception will demonstrate the risk and benefits of the intervention. Innovation inventively proposes change of geriatric care. Patient education is included in this project is to create a change, because when we give education to our older people about how to take care of themselves, how to change how to go to the bathroom, to use the bathroom, to walk around, to do exercise, a little bit of exercise, it will help them. Peer review methods have been applied to frailty and depression problems. While the proposed project should be funded, healthcare burden will be reduced due to the outcome. I have reasons that justify the need to fund this project. Older people need to live a meaningful and purposeful life, devoid of pain and inability to take care of their needs. There will be decrease in cost of care for the older adults. There will be positive changes and more independence in the life of people with frailty and depression. There will be improvements in the quality of life for older adults through these particular projects. And that is why I'm asking you to fund this project, so that elderly people will be able to enjoy their life, will be able to do activities that other people are able to do. And I really, really thank you for listening, and I hope I will get funded. Thank you so much.